Hello and welcome to today's live stream. I am Ivy Prosper, and if this is your first time here on this channel, I tell stories from Africa and the African diaspora. That means telling stories of Africans, of people of African descent, whether they are on the continent or in the diaspora community. Today's program is a live stream with Sam Baddoo, who is the co-founder of Fleri, an organization that's dedicated to helping you get support for your loved ones who are on the continent of Africa when it comes to their healthcare options. And you can also learn today a little bit about you taking care of your health in countries like Ghana as well. He is the founder of Fleri. And as I said, they're in Africa, they're in Ghana, they're in Nigeria, they're also in Zimbabwe and in Kenya. Sam is here joining us for the live stream. Welcome, Sam.
Thank you very much, Ivy. Thank you for having me on your show. It's a pleasure to see you once again.
Thank you. Thank you so much. So today's show is very important because healthcare is something that a lot of people are concerned about in African countries and developing countries. And I thought it was important for him to come onto the show today to talk about his company and what they do to support people with healthcare options. Now, I want to thank everyone who has joined so far. I know usually doing live streams, it takes a little bit of time for people to start getting online because the notifications are going out. And as people are joining, I want to just let everyone know to just let us know where you're watching from. I see Lance Skirv has joined us from Accra. Thank you for joining. We also have Spirit Traveler saying Akwaba. Thank you for joining this live stream. For those of you who may follow this channel, you may have recently seen that I had a situation myself where I had healthcare situation that led to me leaving Ghana and going to Canada. Now, I didn't leave Ghana permanently. I just temporarily to take care of some of my healthcare needs. Now, that is largely because healthcare in Ghana comes with a cost. And if you don't have the right insurance to cover all the things that you need, you can end up going broke, spending all your money on healthcare in Ghana and other African countries as well. I'm speaking specifically from my personal experience in Ghana. So I thought that it was important. I had already connected with Sam in the past when I had heard about his company. I actually randomly saw his video, a video promo that was on YouTube, and I commented. And then he commented back and sent a message saying that he was happy that I had seen his video and had commented and all that. So thank you so much for taking the time out to speak today. We have more people joining. Obia Benser from Accra, thank you for joining. We have CB, so Obia Benser from Accra on LinkedIn. And then we have CB 1971 from Virginia. Thank you for joining. Now, for those of you joining that you maybe missed the beginning, I was talking a little bit about who we have as our guest today. I'm going to let Sam do his own introduction, give us a little bit background about himself and about his company, Fleri.
Yeah, Ivy, thank you so much. It's great to see you, Obi. Been a while. A little fun fact was the fact that I was born and grew up and spent a lot of time in Ghana. Left for a while to go live in Morocco, but went back at a time when Ghana was really blossoming into this country that had a lot of young people coming up and building. My name is Sam Baddoo, Ghanaian, living in the United States. I live in Ohio in the Midwest, and I'm the founder and CEO of Fleri. Fleri essentially exists as a company to help global migrants be able to connect and care for their family members back home in the most efficient manner possible. Our primary focus today is in healthcare, and so we launched Fleri Health to allow folks in the diaspora to pay for healthcare seamlessly, affordably, but most importantly, transparently for their loved ones back home. I'm definitely honored to be here, especially given your own experiences. But I definitely can attest to the fact that almost every single person that you would meet has a story around healthcare and how something has gone terribly wrong when it comes to care back home.
It's very interesting because with me having, some of the health things I went through, the irony is that I was fully aware of the way that the healthcare system is in Ghana. I shouldn't say fully, but largely aware, because in 2012, 2013, I was the host of a TV show called the Maternal Health Channel TV series. Now, we traveled across Ghana telling stories of why women are dying after childbirth. We went to so many rural communities, even within Accra, and we went to so many different hospitals, clinics, healthcare facilities, meeting with doctors, nurses, a lot of caregivers to discuss some of the challenges that existed in the healthcare system. But in any case, there's a wide discrepancy when it comes to access to good care, with the cost factor. Now, in Ghana is actually, the World Health Organization listed Ghana as 135th out of 191 for overall healthcare. There is the disparity of you having the government system through private health systems, and there's a lot of really good facilities in Ghana. That's not saying that they're all bad. There's some amazing facilities like Luca Health, Eurocare. Like there's really great facilities available, but it's the access financially that sometimes people's family members may not have. So when you're talking about assisting with people's family members back home, it is something that could certainly give them access to better resources than what they can afford, right? You're on mute.
So one of the areas where, and you rightly hit on that, is a lot of the time we tend to think it's a lack of availability of healthcare options. But like you rightly pointed out, even in the current economic turmoil that we have, there continues to be development in terms of top-notch quality healthcare providers, right? And you've named a number of them. I'm not going to give them free advertisement today. But the challenge has always been around affordability, and it's actually worsening, right? Why is that? You have a country where 86% of people do not have income predictability because they don't have any formal jobs. A lot of people are either entrepreneurs and working for themselves, and that creates a risky situation in terms of having safety nets. Number two is the fact that 1 out of 9 people today in emerging countries are dependent on a loved one abroad to be able to support the majority of their needs, right? And this is not new. The challenge that we uniquely address at Fleri is the fact that over the last 70 years, the primary way that a lot of us have supported those family members has always been to send money. So much so that it's become this cyclical black hole where you're sometimes sending money and you're not stopping to think, did you actually go to the hospital? Did you get that medication? Wait, did you actually get well the last time you said you were going to the hospital? And it's those questions that we're seeking to resolve. If you take the UN and then the World Bank that does a lot of research, right? What comes out is, one out of every $4 that is sent to remittances today is sent so that people go and get care. But out of every dollar, right, only about 20 cents actually makes it into the healthcare system.
Really?
So yeah, what happens to the 80 cents that was meant to cover the care? And that lack of transparency, that lack of visibility, that lack of accountability is what Fleri Health is seeking to solve. We make it such that the control is back in the hands of that family member that honestly wants to help their loved ones back home. And the way that we do that is by partnering with healthcare providers and healthcare systems in emerging countries across Ghana, Nigeria, Zambia, Zimbabwe, and Kenya, bringing all of their services and packages into a digital platform and making it possible for someone living abroad to, one, discover, understand the details of, and to be able to make a trusted payment to give that loved one back home access to quality care.
Okay. So everybody who's joining, I know that there's people who are joining as we are in the middle of our conversation. I'm speaking with the founder of Fleri Health. Joinfleri.com is the website, and it is Sam Baddoo who is the founder, and his company helps you to help your family members back home to get access to better health care. I'm going to show a quick I want to show a quick, I think you have a quick promotional video that kind of just gives a quick overview of Fleri. Now, let me just get that up so that I can show. There's, you have like testimonials that are on your YouTube channel. So I just wanted to be able to show people one of your testimonials here. Just give me a moment. As you are coming on, please do share where you are joining from. If you're joining from other parts of the world, please do let us know. And let us take a look at this video here of this testimonial.
Dear baby boy, my dear darling boy, Ken.
I would call him by how we affectionately call him. Joe, I am so grateful to you for making it possible for me to be on Fleri.
Thank you so much. Thank you so much, because you've changed my life.
It has really added flavor to my health and my health needs.
You changed my life. I'm so proud of you. We are all proud of you. And may God bless you richly and your family.
Thank you so much. May God bless you. And I'm so grateful.
I'm speaking and my mic is off. I also want to let you know that you can join, you can visit the website at joinfleri.com and get all the information that you need. I can do a quick showing on the screen of the website for Join Fleri, so you can see some of the things that are available, and you can speak to it, Sam, about what it is that you guys offer and how it actually works. So we can see on the screen here. So basically it says your money goes exactly where you need it to. 24 access to care is the difference. It saves lives, the best doctors, hospitals, specialists, labs, and emergency services. How exactly does this work?
Yeah, so Fleri's been around a little over a year, and I started out here with a background in healthcare, worked at Cigna, but focused on the expatriate healthcare side. And so, as you can imagine, you're working at a company where you see all of these Americans running around the world, and it's seamless, right? Regardless of where you go, you always have access to care. The question that we always have to ask, and this is always triggered by something, I'll go a little bit further and my mom about a year ago had a mini heart attack and been taken to the hospital for 2 days.
Oh
No,
no.
oh yeah. For 2 days, guess what? Nobody in the family wanted to tell me, right? And you would always hear this because they didn't want to bother you. Nobody wants to be a burden. They don't want to tell you because you're going to be worried. But after 2 days, guess what happens? They start telling you because they're starting to make a lot of payments and it's starting to get expensive, right? And so for most of us, our first our first time that we hear that something has happened home, it's already critical and it's already gotten really difficult. And so when we started Fleri, our focus was how can we get people access to care such that they don't have to wait for an emergency before we start finding a solution. It's already too late, to be honest. And so we started by partnering and launching a pilot in Ghana with Glyco Medical, Nationwide Health Insurance, and then Premier Healthcare. Right now, there are about 17 health insurance companies in Ghana. There's only about 4 of them that have retail plans. Everybody else is focused on the few companies that are able to insure their employees. Right. So if you don't work at a bank or you don't work at some reputable company, too bad for you. Right. And so when we started with them, the first goal was to be able to get people here to buy health insurance for their families back home, period. And so these 3 companies really supported that goal. And for them as well, it was a really great opportunity for them to start growing with a new audience. Today, however, we go beyond health insurance, and there's so many reasons why. When you get on the platform, it starts by asking you, where does your loved one live? Once you put that in, you put in the city where they live, it allows you to choose who is it. Is it an adult? Is it a child that you're trying to cover? And how soon do you want them to get access to care? Once you do that, it takes you to what we call our categories of care. We've learned over the last year that no one size fits all. People aren't just looking for health insurance plans. Sometimes people have cousins and siblings who are struggling mentally. And so our categories of care cover anything from telehealth and remote care for people who have family members that are constantly mobile or live in rural areas where it's not easy to get access to a facility. We have access to home health care, right, or concierge care for folks who want convenient access to care and they want the doctor to come to them. We also offer access to geriatric care or elderly care for those who have elderly family members who require for a nurse to come live in-house, or for that nurse to go and then come back for longer hours of the day. We give access to mental health and wellness. And so we have providers like Nguvu and others that allow for your loved ones back home to discreetly get access to mental health therapists as well. And then we offer access to prescription management plans for folks who have family members with chronic illnesses who need access to the same medication constantly, kind of like myself with a diabetic dad. And then we cover most recently emergency healthcare. So what happens when your mom gets into an accident, right? How do you get a paramedic to her? If you've ever lived in Ghana and you tried calling the ambulance service, you know exactly what I'm talking about. And so we launched a partnership with a company called ERA, Emergency Response Africa, and a few others across the continent to be able to get private paramedic access that comes to you on a motorcycle. So it's faster, it's dispatched privately. And it also ensures that, if you're home and something happens at night, right, you're on a priority list and you know the number to call to be able to get that particular service. And so you can select any one of these categories of care, and you will start to see the different packages from these facilities that are there for you to be able to access. Once you've done that, you're able to enroll them in it. You get through your welcome call where we make sure that we really understand what your needs are, what your family's needs are, and to make sure that the plan that you're picking is the right one. Once that is set up, we talk to your loved ones back home. We do our verifications, and then we onboard them. Once that onboarding is done, you're sent an invoice, you get to pay for the plan, and they start getting access to that care.
Perfect. Now we have people joining. We have one person here. Mercy's asking, does it work? Can you share testimonials?
Yeah, absolutely, Mercy. So when you go to our YouTube channel, we do have some testimonials there, and there are lots of people that have been on the plan over the last year and a half, right? That can share, and we can even connect you with people if you wanted to talk to them. I can give examples of some of the things that have happened for you to see how this works, right? So. I remember back about a year ago, right? We had a lady in Nigeria, in Abuja, who at 2 a.m. in the morning has her mom running out of breath, right? What do you do today when you don't have any service and all you do is trying to find a hospital? She can't go anywhere. She's finding it difficult to drive because she has 3 little kids, right? The good thing with Fleri is you get assigned a family care representative. This allows you to be able to text them via WhatsApp or reach out to them because their job is to essentially service your family. We immediately would either make an appointment or get an ambulance to come to you. And this has saved countless lives over time. So there's several testimonials and experiences that people have had to go through that without a dedicated group of people looking out for you and your family back home, it can get quite difficult and expensive to navigate healthcare for them.
Okay. Thank you for your question, Mercy. Yes, I did see that there's a couple of testimonials on your YouTube channel. I don't want to necessarily, I could play one, but I know it's more than 2 minutes, and sometimes people's attention span can get a little bit short. But there are some testimonials on the YouTube channel. If you would like, I could bring one up. We could watch part of one, and then you get an idea of somebody who's given their experience. This gentleman's name is Mr. Hayford. Let's see what Mr. Hayford has to say about his experience. In the meantime, anybody who has questions or comments, please do share them in the comment section. You can reach Sam by email by contacting him at joinfleri.com, right? And send him a message directly. I want to mention that, Sam, we talked briefly about possibly making an offer to people who are watching today. I don't know if you wanted to do that today or if we can talk about it later, but we can certainly bring that up as we go along.
Yeah, we can definitely talk about that, and we'll most likely do that as we get to the end. I did promise that we were going to give something away for this event, so I'll try.
We can talk more at the end. I just want to bring it up so people watching can know that there's something coming at the end, so that you can see what opportunity there is for you to help your family members with this service that Fleri Health has. So I'm going to share the screen of this gentleman and his experience with Fleri. So this is about just over a minute, I believe.
A lot of difference in that there are no, limitations to the extent with which you can go with maybe an investigation on your health. For instance, around 25th September 2001, I was taken ill, and they were trying to figure out exactly what was wrong with me. And they carried a series of investigations until at some point I was made to go and test for COVID. And it was not COVID. And they didn't stop there. They still continued until another medical investigation and endoscopy or something. They did that one, and that was what led them to the sickness. Apparently, they said it is a sickness that had been there. Oh, yes.
So I heard him saying 2001. I think he meant to say 2021 in that video. Is that correct? You're on mute.
Yeah, I was saying, yeah, he meant to say 2021. Yes, because everybody was still dealing with COVID at that time. But he made a point about something that a lot of the times we get to see here that for a long time we're trying to figure out, right? Very recently, I was in Chicago and at the Ghana Fest and met a lady there. And we had giving out these coupons, or they're basically like cards that you can redeem for health examinations, right? And just like everybody else, she was really skeptical. She was like, "Oh, I didn't even know they had like insurance in Ghana, or I didn't know that there was a company that could help me get care in that way." This lady finally took us up on the offer. So she called in and said, "Hey, I have my dad in Ghana, but if you're going to give him a medical check, let's see what happens," right? You will be surprised that, and we work with a partner in Ghana called Express Med. They do all of our at-home medical exams in Ghana. And so the doctor had gone to her dad's house only for him to be tested. And then we found out that the man was excessively hypertensive, was at risk of a cardiac attack. And he was just there, right? Nobody knew this. The next day, he had to be rushed. She hadn't even purchased a plan or anything. He had to be rushed to a hospital. And you think about the fact that so many times we're sitting here and then something happens back home and then we're like, oh, it has to be a fear before, or like, something happened and we don't really know. So many people live with illnesses that have never been on earth until there's an emergency. Yeah. And that was the case with Mr. Hayford as well, right? Because the cost of care is so expensive, we don't have a culture of preventative healthcare. The only time that people start to really think of healthcare as a form of self-care is when someone is actually footing the bill. And if you think of it, why would I, living in America, want my aunt to be going to the hospital when she's not sick? Well, guess what? If my aunt actually does get sick, I would have to foot the bill. So if I can pay $30 or $40 a month so that she has an insurance plan where she can walk into the hospital at any point in time and she prioritizes her health now, she's healthier, she lives longer, her quality of health is a lot better. And it saves me on always having to send money back home to do that in that way.
Okay. So I have people who've been joining who weren't here from the beginning. We have Gwendolyn Miller-Jones, who's just joined. She says, "Hello, I joined late. If you have an opportunity, please share the extent of services. I'm not clear about what is available." So if you wanted to, I'll do a quick intro for those who are just joining, because I'm sure she's not the only one. Today, I am talking about access to good health care in Ghana, also available in Nigeria, Kenya, and Zimbabwe, correct? Yeah. With Fleri Health. They are a service provider that you can use to help provide healthcare access for your friends, family, relatives who are living in those countries. What I want to know is this all, do you also have a service for somebody who doesn't have family members and they want it for themselves? If somebody says, I want it for myself, is that also a possibility too?
So today we don't restrict people for buying that care when they're home, to be honest. But our primary focus today is on loved ones, friends, family members, and the reason for this is all of the plans that are available on there are subscription based, right? So, especially with insurance plans, they're annual in nature. If you're going back and forth between here and Ghana, then that becomes a challenge to do a half year. But if you're looking for a remote or telehealth plan, if you're looking for a concierge care plan where the doctor is coming to your home, yeah, absolutely, you can actually purchase a plan and then have yourself on that plan. Yeah.
You can purchase for yourself. So you can purchase for yourself or for loved ones.
Yes.
Okay, perfect. I hope that answers your question, Gwendolyn. Anyone who wants to go to the website is joinfleri.com to get more information or to register through the site, get more information. You can send an email to Sam if you have any questions that may not be answered this evening, or if maybe you're not able to stay on for the whole live. You can also visit their social media pages, follow them on Twitter at Fleri_global. Follow him on Instagram at Join Fleri, where you can get more information as well. We have another comment here. It's a thank you. Thanks so much.
And this might be if you're just to make sure that people who either come on and are not staying the entire time, I will say this. I did make the promise, and so I am going to do it. Over the last year, one of the things that has been really outstanding is how do I make a decision about what care plan to buy, right? People ask us that all the time. How do I know what my loved ones are actually experiencing? Because the overwhelming majority of people who live in Ghana, Nigeria, and this is not just a Ghana, Nigeria problem, it's across all of the emerging countries that we're in. Nobody gets up, or people do not get up and go test themselves or go see a doctor because they just want to do a checkup, right? Because it's expensive. And so we had that question come up so many times. We actually launched a whole program to be able to support people with that. And so today, one of the things, and don't mind that Sam, he's up now. One of the things that we want to do on this program is to give everyone who's listening a link where they can go and they would be able to enroll one loved one, one friend, one family member to get a complimentary at-home medical exam. So we'll send the doctor to the house. We run a 5-test panel, and it usually is checking for heart health, is checking for blood sugar, pre-diabetes, is checking for kidney functions. We will provide this at no cost to every single person that is listening today or watching the show. So I will send the link in here for them to get access to it. This is not public yet, but if you go to my.joinfleri.com, you'll be able to actually sign them up for a MedCheck exam. And that will be entirely at no cost to them. It usually costs about $50 for people to do a pre-check. We're giving that to you for no cost.
Okay, so that's for today only?
That's going to be for your audience because this is not, yes, it's not public. It's not available to anybody. This site is just being shared here.
Okay. Let me just put this up on the screen. my.joinfleri.com.
Yes.
Okay. So this is for my audience. When you use this link, as he explained, you'll get one complimentary assessment
Yes, and you can open it up and kind of run them through it. It talks about what the assessment checks for, and this is as a result of like over a year of talking to people and realizing that the biggest gap that exists for people in the diaspora is just knowing where their loved ones are health wise, right? And once you have someone on a Fleri Care plan, every single year we offer this free checkup for them and continue to track their health across the years, right? The goal is to be able to get people to a point where they're healthy enough so they're not calling you constantly to send money back home.
Let's see the comments here. We'll tell you more about gut microbiome. I don't know what that means. The session is free to watch. I'm not sure what you're referring to, Patricia, when you're talking about gut microbiome. I'm not sure, but I appreciate your comments. If you want to clarify what you mean, that would be great. So thank you, Sam. This has been so informative so far, and I hope that everyone that's been watching has found this to be very useful information. Because one of the things that's definitely true for people who have family members, and I can speak to this from personally. I know that there's family members who would call, like all my life growing up in Canada before moving to Ghana, there would always be people who would call, and there might be some medical emergency that people need something. Also with some of my other friends who have family members abroad, same thing. And I even have some friends who they came to Ghana on holidays over, they stay for like a month or 2 months, and then they've made friends in Ghana. Next thing you know, these friends of theirs are contacting them, and they're not even family. I know somebody who he does business in Ghana. So he comes to Ghana every few months and he stays for like 3-4 months doing his business. And then he's exporting. And he finds that when he leaves to go back to the US, the people who he's doing business with or friends with, they're contacting him now and asking, for support when they have health emergencies. So definitely this is something that is problematic because a lot of people don't have the finances or the resources to be able to take care of their health. Because even though Ghana has a national health insurance scheme, I want to make everybody aware, Ghana does have a national health insurance scheme, which is designed to help people to be able to get their health care needs taken care of. Now, even though that exists, it doesn't cover everything. It only covers a certain specific group of illnesses. It tends to cover some of the local illnesses. It covers malaria, things like malaria, diarrhea, some of the respiratory diseases, basic hypertension, diabetes treatment. There's like basic level things that it covers. But I do know of people who have said that they've gone in with their national health insurance scheme card to the doctor or the hospital, and then they find out it doesn't cover fully all of the things that they need to be taken care of, or even some of the prescriptions that maybe it doesn't help. So it's not fully comprehensive when it comes to an overall healthcare. It just covers the absolute basics.
Yeah, you're definitely right about that. And there are other countries on the continent that are also either attempting or trying to build universal healthcare programs as well. But it's very limited in terms of what it provides. One other thing that I wanted to run across is, recently we've seen a growing trend of people living in the diaspora, but either doing business or employing folks back home. Today, this person didn't show up to the shop because she said she was sick, or the next day, one of my employees did not come up because they said they had to go to a hospital. And this is almost recurring in the way that it starts to hamper your business, especially if you live in the diaspora and you're trying to build a business back home. And so we started working with companies that are hiring on the ground in Ghana, in Nigeria, in Zambia, and across, to help them start ensuring and start covering their workers with healthcare access. One of the problems that solves on our end is the fact that most often you don't want to go register an entity in Ghana to be able to do business, right? You're here, you're not making money there. You're either exporting and taking it there, or you're doing something else, right? Most insurance companies will require you to have 20 employees before you're able to get a plan with them. Fleri allows you to be able to avoid that by giving you a marketplace that makes it easy. You can sign up you can sign up 10 people, and you can mix and match the actual coverage. So you could have your managers in the country have access to an expensive health insurance plan, and you can have your junior level employees and salespeople have access to either a telemedicine plan where it's for 24/7, they can call a doctor and talk to the doctor, or they could be on a home healthcare plan where the person will get the visit at home, and it will cost you a lot less. So I think some of the use cases go beyond just family. But the goal is to be able to make it possible to provide care and support for someone across borders without having to do so many gymnastics.
Okay. Very, very informative. So that's really good to know, because like you said, there are people who are employing people, starting businesses, and they want to have a good system for healthcare access for their employees. So that's really good to know. I'm glad that you brought that up, because definitely there are people who are doing that. Particularly, I meet a lot of people from the diaspora who are working with people in Ghana who are building business, whether it's like a fashion business and they have people who are sewing, they have, a weaving business, that, they have the people who are working for them. So this is really good to know. Now, though I know that the plan is designed for people in the diaspora who are supporting people home, and you already answered the question that they can get it for themselves if they are in Ghana as well. I wanted to know if somebody, like the one that you just brought up about the business, if somebody's running a business in Ghana and they're not in the diaspora, they're in Ghana, can they also purchase this as well for their staff?
Yes, they can. They can. They can also purchase this for their staff. And so if it's a business that's not big enough to be able to provide a big health insurance package, the advantage is the diversity of healthcare packages that they can purchase. They're not just limited to health insurance, right? And we work all across with a lot of people. We work with BIMA. BIMA is the world's largest provider of mobile delivered care, right, across multiple countries. BIMA provides a 24/7 doctor service. They provide access to prescriptions that will be delivered to you. And so you can enroll them in a BIMA care plan, for instance, that would give them access to the BIMA service. But this time, you as the employer is the one that's paying for it.
Okay. All right. So thank you, everybody who's been here today. I've been talking with Sam Baddoo. I know he's had a really busy schedule the last little while, and we have been on for almost 45 minutes. If anybody has any last minute comments or questions that they want to make, please do put it in the comments section. Just a reminder that it is Fleri. They are available for Ghana, Nigeria, Zimbabwe.
Zambia, Zimbabwe, Kenya as well. Yeah. So
yes. Yeah. All right. So this is something that is really definitely beneficial and helping to support people when it comes to healthcare needs. You can follow them on social media. They are on Twitter, Facebook, and Instagram, and also on YouTube. You can find them and follow to get all of the latest up-to-date information from them. So let me put up the handles so that you know where to go. So Twitter is Fleri_global. Instagram is Join Fleri. And then Facebook is Join Fleri. Let me put the Facebook on the screen so that y'all can see the Facebook page. And it's a great place. You have people who can interact with them and have questions if they want to go to the social media pages.
Yes, we do. So all across, we've got people in Ghana, we've got people in Nigeria, we've got people across. So yeah, regardless of where you are, we'll take care of it.
That is the Facebook page. Oh, I got a pop up on my Facebook page. I see there popping up. Yeah, so that's the Facebook page. This contact. There's a contact number on the Facebook page. Is that a current number people can reach?
Yes, so it's a number you can reach, and you can either call, send a message, text message. It will come to us.
Okay, that's showing as 1-614-820-5302. So as you can see, there's posts coming up giving a lot of information here about what they do and what they offer. It is a very important service, and I think that, I mean, it really, for me, has been something that hit home, because as I said, I've had some health things that I've been managing and stuff. And so I think it was very, very important for us to do this live stream today to talk about what you do. So a reminder that everyone, you're watching this channel, my audience, you have an opportunity to get one free health assessment for one of your family members, friend, somebody that you're looking to support. If you go to my.joinfleri.com, I'll put that back up on the screen. That is for those of you in my audience. Special promo is my.joinfleri.com. Go to that page and you will get the opportunity to get that free assessment for a loved one in your family. That's it. Just thanks so much. I would also like to extend it to Africa too. I think she has a service that she's talking about. She's talking about diseases start in the gut. And if people want to reach out to her, she's offering a service for her healthcare stuff that she's talking about. Yes, I do hear a lot of stories that what we eat definitely affects what the outcome of the way our bodies respond, and I do believe that a lot of what we eat does affect us. And the unfortunate thing is, it takes so much time. Like, somebody could have been eating certain food for like 40 years, so now it's compounded, and then they're trying to counter those issues that they had. So but thank you for bringing that to our attention. King Joseph says, hi, Ivy, greetings from Los Angeles, California. Peace and blessings to you. Thank you. Thank you so much for joining. I appreciate you. We are wrapping up now. Do you have any final things to say, Sam?
Yeah. So what I will say is, it does pay for us to reach out and check on the folks back home, especially when we know that when things get tough, we are the people that they count on. And for me, I really always want to start and end with value. If you don't know how your mom is doing, this is a perfect opportunity for you to say, hey, Christmas came early. I want to get your health assessment. I want to know where you are. It empowers you to be proactive about their care and help avoid costs that kind of compound in the future.
Great. Thank you so much. I appreciate you spending the time with me today to talk about this. As I said, I know you have quite a busy schedule, but this was a very important topic, conversation. And I think that what you're doing is really great. You're offering a great service. Also, if you're interested in, investing in the business that he's doing, there's always value in investing in health-related businesses. It's an industry that does need support. As Sam said, he's been in business for just over a year.
Yeah.
Just over a year. And, startups can always use the support. So if you are a interested business investor, you can also reach out to him in that capacity as well. His email is sam@joinfleri.com. He can always use the support, as any business does. So, let's see. King Joseph, health issues is a big problem here in America. It seems like it's an issue on the continent. Yes, health issues are problems worldwide. It's a problem worldwide. And today's focus, I'm not sure when you joined, King Joseph, today's focus is largely about the accessibility that people have based on their financial resources and access. So this is a plan through Fleri that helps to support people in being able to have access to healthcare. So it is like an insurance that helps them to be able to access more than they would with the basic national health insurance scheme that's available in Ghana. So thank you so much, everybody, for joining today. If you've missed it from the beginning, you can always watch the replay. It will be on my channel. I appreciate you. If you found this video to be useful, don't forget to like the video and to also share the video with anyone who sees value in this information. I hear someone crying back there. I think probably needs your attention. That's okay.
That's
Okay.
always that.
We're letting daddy go and go and tend to that because that is very important family time. So thank you, everybody. We are about to end the live stream and I will see you next time. And quick reminder of checking out the page for that offer for my followers right here, the special promo, my.joinfleri.com. All right. Thank you so much for watching and I'll see you next time. Don't go anywhere yet, Sam.
All right.
We'll chat. Thank you everyone for watching. See you next time.